back for another episode of Branching Out with Sierra. In today's episode, we are going to be joined by Mark Nantz, the president and CEO of Valley Health. I'm very excited about this conversation as we talk about transformational leadership. This episode came about because I attended Business at the Bloom this past year, and I noticed something really cool happening with Valley Health when they all stood up and did an affirmation together, and it made me very curious about the culture at Valley Health. Valley Health is very well known in our region, makes a really big impact on our communities and in healthcare across the board, and I wanted to spend some time with Mark to get to know what he has been doing to build this amazing culture and to hear his thoughts on transformational leadership. So thank you for joining me today, Mark.
Well, thank you. Thank you for having me, Sierra.
Yeah, of course. I'm so glad you could come. So can you share with the listeners, because they're not all local too, so
Okay.
Some folks might not know, a little bit about your background and what brought you to Valley Health in our region?
Sure. Well, I was born and raised in Charlotte, North Carolina. Went to school in Charlotte, North Carolina, University of North Carolina at Charlotte, 49ers. Got a degree in accounting.
Okay.
And out of college, went to work directly at a public accounting firm, KPMG Pete Marwick.
Oh.
And after about 5 years in accounting, I was like, I really don't think this is what I want to do long term. So I actually answered an ad in the newspaper to get a director of finance role at the local health system in Charlotte, and fell in love with the idea of delivering care.
Okay.
Even though I wasn't a clinician per se, the idea that vicariously I was helping take care of my friends and neighbors. And from there, it really just kind of ballooned. I got one bigger job to the next bigger job, went back to school and got a Master's of Health Administration to kind of get the finance monkey off my back, even though I was a CFO for many years in healthcare. And I became a CEO in healthcare in 2006 in a town in North Carolina called Cabarrus County. Cabarrus County was the county, Concord was the town.
Okay.
And so I became CEO there in 2006. From there, I became CEO at Bon Secours St. Francis in Greenville, South Carolina in 2009, and then worked there until I took this job in March of 2020. So that's kind of how I wandered here. I'm a recovering CPA, but it was a really good basis, foundation for being a CEO. But you can get to be CEO a lot of different ways.
Yeah. No, I'm sure that's a great foundation to have. So did you know much about our area prior to taking on the role?
Hardly anything.
Yeah.
I had been mostly in big cities.
Okay.
Like I say, Charlotte's a pretty big city. Concord was just a bedroom community of Charlotte, and then Greenville's a thriving community, big pretty big place. And so when I got the opportunity, my wife and I were living in Greenville, and she was like, "Winchester, where's Winchester?" And I said, "Well, I think it's a really cool place." And so when I came up for the first interview for the job, my wife insisted on coming with me. She said, "You're not going to go up there and fall in love with a place that I can't live."
Mm-hmm.
And fortunately, and it was fair. And so fortunately, when we got here, we felt like, this feels really good. It was a little smaller than we were used to, but the vibe that we got from both the health system and from the community, it really was great. My first experience was going to Village Square and having dinner,
Yeah.
and it being so cold in January of 2020, and walking down the Walking Mall, and it's kind of spitting snow, and it's about 7 degrees, and we were like, it can't be this cold all the time. that almost lost us right there.
Oh,
But
I'm so glad it didn't.
But we had a great experience there. We still, we ate there with the same waiter, Jeffrey. We ate there Saturday night, and it's been, we just feel like we're part of the scenery here now.
Yeah, that's awesome. I think it's funny that, this is small to you, because to me, this was the big city when I was growing up. It's a town, Yellow Spring is where I grew up, a town of less than 300. We don't even have a stoplight. So we would come here for gas and groceries and everything. So yeah, this is big city to me, but small to you.
Well, yeah, everybody comes here on Saturday. That's
Yeah,
for sure. The
that's
Costco
true.
is a big deal
It's a
on Saturday.
happening place. It's a happening place for sure. So March of 2020, what a time to start. Tell me about that experience.
Yeah, it was. Yeah, I got the job on March the 6th.
Okay.
And I was skiing. I'll never forget. I was skiing out west, and I was supposed to start in June.
Okay.
And so the 6th was when they were talking about this virus, right? This first, and you weren't wearing masks yet, but you were being told to wash your hands, and so we got home on March the 13th after the trip, and that was the day the world shut down. And so we thought we were just going to take 3 months off and chill out, and when it got really clear that this was going to be something big, the board of directors thought, wow, we're getting ready to make a lot of changes, a lot of decisions. This could be something serious. And so they asked me maybe you need to start weighing in on how we do things.
Yeah.
Because you're getting ready to, whatever we do now in the next 3 months is what you're going to be holding. So I ended up pretty much coming up in April and working alongside the previous CEO and beginning to influence the decision making. So it was kind of a weird way to start. I mean, never done that before.
Yeah. But the ability to work alongside the previous CEO had to have been a good experience, though, to get a good understanding of the way things had been done. Is that typical when you've moved into other organizations? Do you have a short period of time?
Oh, absolutely. You usually have this transition. What you find out, though, is people who are CEOs really don't want a lot of transition time. Neither the one leaving nor the one coming want a lot of transition time, because you kind of have your way of doing things. This was a very unique situation in the sense that we had an individual who'd been here a long time, had done a good job in the community, and knew the organization. But so I think it was helpful that we went ahead and made that transition over a couple month period, and I got a chance to figure out how the decision making had been done, and then really kind of how I was going to change it as we went forward. And so I was very deferential to him, and until it was my turn to sit in the chair. And then he was super professional and was ready to exit stage left as soon as I got there. So it worked out well. But when you have two professionals who really all we cared about was trying to take care of this community. The big thing was neither one of our egos. It was how do we take care of these people? Neither one of us have ever done this before, and us working together, I think, it was positive for the community. It was good for both of us, and he was ready to leave when it was my time, and I was ready for him to go.
Perfect. Yeah, that's ideal. So for those that don't know Valley Health well, whether they're outside of the area or just don't know the region in which you serve, can you give a little background on Valley Health?
Yes. Valley Health we're 6 hospitals. We're about 75 other locations, doctor's offices, rehab clinics, imaging centers, those types of things. People always think of the hospitals first, but there's 6 hospitals. We cover about 8,000 square miles. In about 16 counties. We go as far up as Hampshire County, West Virginia, as far down as Luray and Page County, down the 81 corridor. We're about 6,200 employees, which is a pretty big organization. We're the largest organization in almost all the communities that we serve, which isn't uncommon for the health system. And we have revenue of about $1.6 billion per year.
Yeah.
So that's kind of an idea of what we do. The 6 hospitals vary in size. Winchester Medical Center is what we call a tertiary or quaternary care center, where we do trauma, pretty much everything. And then we have a community hospital in Front Royal, that's Warren Memorial Hospital, and that's a community hospital, less sophisticated in terms of the level of acuity than Winchester, but quite a bit can be done there. And then the other four are what we call critical access hospitals, and they're exactly what their name would insinuate. They are the safety net for care in the communities that they serve.
Okay.
And they are truly a blessing for the communities where they exist. One's in Hampshire County, one's up at War Memorial in Berkeley Springs, one's in Page County, as I mentioned, and the other in Shenandoah County.
Okay.
So those are smaller places with emergency rooms and inpatient care, maybe not as high a level of trauma and other surgical services. But that's kind of who we are. And that makes us a mid-sized system in the bigger scheme of things. Not small, but not, multi-state large.
Yeah. No, that's good to know because I have nothing to compare it to. Valley Health is all I've ever known. So I mentioned earlier the small town I grew up in. I was in Hampshire County, so I went through Hampshire County schools. So definitely remember being up there because I went to Hampshire High, and that's where everybody went for care.
I was up there last week.
Were you?
Oh, absolutely. And I think we're pretty well loved up there.
Yeah.
Which is really good. The small towns, they have a great appreciation that we're there.
Yeah, I can see that. So tell me a little bit about what it's like to lead in healthcare, because I have to admit I've only had a couple of guests in healthcare. I don't know if you're familiar with Kelly Botta from Smarty Pants Medicine. So she's doing direct care, primary care, physician in the area, amazing. And I haven't had a ton of other healthcare professionals. So tell me a little bit what it's like to lead in healthcare.
Well, I mean, I refer to it as a ministry all the time. I can tell you I didn't always treat it that way. When my first two institutions in healthcare were secular systems, they weren't faith-based, and I led differently then. I led by the numbers and by the business ideas and what's the return on investment and how do you do things the most efficiently. Those are all very important things. But until I had my first experience in faith-based care, which was Bon Secours, and met the Sisters of Bon Secours, who were the people who started the system, I learned the idea of that when you work in healthcare, you have a ministry footprint, not just a business footprint. And they taught me the concept that really either everybody matters or nobody matters.
Okay. And
when you look at it differently, when you're not looking at just the dollars and how to manage with the smallest number of FTEs or, how to sell the most widgets, when you think about that what we're doing is taking care of people, and in general they're our friends and neighbors, it starts to feel more like a calling. And, that sounds like a religious term. It's not really. It's more of a vocation, but I feel called to serve. And from the time I worked with the sisters, every job that I feel like I've come to and the way I approach the work is this is a ministry. It's a ministry of healthcare. We're dealing with people's lives, and we're really dealing with their most precious gift, which is their health.
Yeah.
And we don't realize that until we start getting some miles on us, right? And then we realize, wow, things. These aches and pains could turn into real things. So I think for me, I feel like I approach it as a ministry, as a calling, and that makes it very meaningful for me.
Okay.
And it makes it real. And it's a hard job, but it doesn't seem so much as a job as it does that I'm serving my neighbors and my friends.
Yeah, I can see that. It's powerful. I talk a lot about purpose with my clients and finding your purpose. And once you find it, you can tell people are passionate about what they're doing and they look forward to being there every day. It's not a job anymore.
And we coined the phrase shortly after I got there that we're connected to purpose and driven to excellence.
Oh, I love that.
And the connection to purpose is that calling to the ministry, and is my set of values, are my values aligned with those of the organization? And I tell every new employee in orientation, if your values personally don't line up to ours, this is going to be a miserable job for you. You got to go wherever you go. You got to go where they're about what you're about. It's got to be important to you, or you're in the wrong place.
Yeah.
So it's connection to purpose. We want to be really connected, but we want to be driven to excellence as well. So that's kind of how we position ourselves. That's the beginning of the culture change that we've tried to embark upon at Valley Health.
So what are some of the key values of Valley Health?
Well, I mean, excellence is one, collaboration
Okay.
is one, integrity. The values are really how we behave, right?
Yeah.
Mission's what we do, and then the values are how we do it. And so we've tried to incorporate them. Collaboration. We work together. That's a big value for us. So, and integrity. We do the right thing, even if it's the hard thing.
Yeah.
And I think that we lead with that. We lead with the mission, vision, and values, and people kind of get an idea right away that that's kind of how we run the place. They're not just words on the back of your badge. I mean, this is kind of a expectation for behavior, and so that's kind of where it all starts.
You're speaking my language. No, seriously, that's what I preach all the time. Every organization I work with, that you have to get those values defined, get everyone on the same page, make sure you have a clear mission and vision that everyone understands, and that it does build the culture, and it helps people to very clearly see, do I belong here?
Right.
Right. Once it's defined, it's pretty clear if it's a good fit or not.
Yeah, and I think we want all of the people to stay. Right, but we try to make it really clear on the front end that this is what our mission is super simple. We're here to serve our community by improving health. If you can't get behind that, we don't say we're here to do as many MRIs as we can, or to have as many patients in bed. We're here to serve our community by improving health, whatever that may mean.
Yeah.
And we believe that we're the stewards of this community's health, and here's how we think we should do it. And most people feel it. I think most people feel it pretty quickly. That's not just something we say.
Do you think that culture itself is something that really helped to sustain you through COVID?
It's interesting. We were, the board of directors when I got the job. They said, we're doing pretty good financially. We've got nice buildings. We think we've got good clinicians, but we think we have something of a culture problem.
Okay.
And they measured that by employee engagement, right? Everybody's got a tool for measuring employee engagement, but for whatever reason, the engagement had dropped in some places to the bottom decile. And system wide is like 17th percentile, which is low.
That's significant.
And so what it indicated to the board and to me was, somewhere along the line, the people on the front line have lost the trust in the people who are leading and calling the shots, and that could be a communication issue, that could be a real trust issue, but they'd lost faith in the leadership and did not. I don't think they felt valued.
Yeah.
And so that was a pretty big. I've been to a lot of places. I'd never been looking up from the 17th percentile, trying to
lots of room for improvement.
Yeah, trying to get up from there. But the management challenge that creates is, I'll go back, Sierra. I have a philosophy. I have a strong conviction and a philosophy that the number one thing is the people. And if the people know you care about them, if they're led in such a way that they feel valued, and if you give them a purpose and you rally them around a cause, and they can trust that, you might do some hard things, but you're not going to balance everything on their backs. They're not going to be the first thing. I think if you can get the people right, and until you can get it right with the people, that social contract that a leader has with his or her constituents, if you can get that right, then financial performance can improve. Then patient experience can improve. Then clinical quality can improve. Then everything gets better, but nothing gets better until the people are valued and they feel right. And so that's where, that was like, for me, that was job one. The idea, though, that I was going to have to do it in a pandemic where trust was pretty low.
Yeah.
And, I mean, let's think back.
Oh, yeah.
So that was a pretty big hill to climb. And so we were really, I don't know, I'll be honest with you, I was like, man, I don't have all the answers here. I don't know how this is going to work out.
But what did that look like? Boots on the ground, trying to build trust with folks you had never met before during a pandemic. What are some of the actions that you took immediately?
Well, there were a ton of podcasts, a lot of communication, very awkward. I'm usually a person who just goes and walks the floors. But, right at that time where we were, they didn't want strangers on the floors, right? And there's kind of some fear to be there anyway. But I guess one of the biggest things we did when I came in April-ish is a lot of health systems across the country said that we're going to furlough employees. And there was a conversation, there was a board meeting where the board discussed, maybe we should furlough 1,200 people. And that was when I got my first call, which was, hey, we're getting ready to take some actions here. You might want to weigh in.
Yeah, I'd say so.
And so that was the first. I knew I'd made the right decision when I got a call from the board chair and vice chair and really the executive committee, and they said, hey, what should we do in this situation? And I know it makes financial sense to furlough 1,200 people. They're not doing anything. But that seems like that'll have long-term, and that's what I mean. The first thing you do, if you balance the budget on the back of the people, you're showing them what matters to you, right?
Yeah.
And so I remember talking to the board, and I was like, this was like kind of crazy. They said, how much do you think it would take to keep everybody working? And I said, I don't know, probably $50 million if it was, if it's a 3 or 4 month shutdown, whatever. And they said, all right, if that's what it takes. And I was like, okay, I made a good decision.
Yeah.
These are good people.
Yeah.
And so we were able to tell people immediately when they were scared, everybody's thinking about being, laid off or whatever, furloughed. Hey, everybody's going to get paid whether you work or not. And I think that was an opportunity that I had to say, hey, look, this is going to be how we do it.
Yeah.
We're going to take care of you. And what was great about that is we never spent that $50 million because the government gave us the provider relief funds like 6 weeks later.
Oh.
And so had we made that decision without that information, it would have sent a message to those employees like who I was. Instead, what they got was, they were going to pay us anyway. And so that really kind of, those are the things you build trust on.
Yeah.
And so I've tried to continue to listen to what they say. And the other thing I think I do is and I don't know how I can keep talking, or you can ask me more questions.
No, you're doing great. I'm learning so much.
So one of the things that we did very early on is we took all 300 leaders, as soon as we could gather in a room, we took 300 leaders and we created something called Foundations of Leadership.
Okay.
And it was modeled off of faith-based, but it was completely secular. And it was about connecting people to purpose. What is your connection to purpose? What are your values? Are you in the right place? And are you valuing your people? And it's really, we're telling stories. Because, that's, people remember stories.
Yeah.
We're telling stories. I'm talking about how I started, my vulnerable, I'm being vulnerable because you gotta do that. I'm a big fan of Brene Brown when you think about it. You gotta show some vulnerability. And one of the things that I started that meeting with, and still do whenever we have new leaders, is there's an apothecary jar, yay big, and it's full of quarters and dimes and nickels. And at the time, it had about $8.50 in it, and I had 300 of them made up one for every leader. And I asked them, I said, "Can anybody tell me what this is?" They're no. I said, that is the average hourly wage of our lowest paid employer after all their deductions. It's $8.50. Every decision you make, it impacts them more than it does anybody else. So let's be really clear. We're making decisions for that person. And that really kind of like sets a tone.
Yeah.
And so we still do that. And if you'll go into pretty much any leader's desk in Valley Health, you'll see an apothecary jar full of change. And we like to think that that's the first thing we look at when we're talking about a tough decision, whether that's furlough or whether that's shutting something down, closing a service, growing a new one. How's it going to impact those folks? Now, I'm happy to say that there's about $8 more in that jar now.
Oh, that's wonderful news.
Because we've been able to get the minimum wage up a lot more.
Yeah, that's great.
But that's just part of the work we did. It's not just money. It's really how we behave and how we act. And I think we've treated them in a way that makes them feel valued because they are.
Yeah.
And last year we finished our engagement score at the 69th percentile.
I was just about to ask that. I'm so glad you shared.
I'm not going to brag on a 69, but it is, a whole lot better than 17th or 21st. Yeah. And I think that it has been true that other things have improved. Our perception in the community's improved. I think our care's improved. So we're hoping to get that up way past 70. But it's pretty satisfying to know that the message is getting through and people are feeling it, not just, you're not buying it.
Yeah.
Actually people are buying in. And I hope they continue to. When they don't, then it'll be time for me to go, because you can't. If people aren't picking up what you're putting down, it's hard to make it work.
Well, congratulations. That's amazing. That's a huge impact in 5 years.
Good team, a very supportive board, and a workforce that wanted to be engaged. So not a one-person deal. It was a conscious effort on all of us that we found our connection to purpose.
Yeah. Wow. So take me back to Business at the Bloom. So you were speaking, and I was trying to remember exactly how it played out, but you had all Valley Health employees stand up, correct?
Yes.
And tell me what you did.
Yeah, so when we did this Foundations of Leadership, one of the things that I wanted to do, and it sounds kind of hokey, but I wanted us to have some affirmations, and they're based basically on our mission and our vision and our values. And if you've ever been a part of a athletic team, if you've ever been in Future Farmers of America or 4-H, or Boy Scouts, everybody who has a sense of community together, there's a lot of times there's an affirmation or a saying, or 1, 2, 3 break, whatever. But it's we have huddles every day.
Okay.
And one of the things I was trying to get to was, after our huddle every day, wouldn't it be great to remind ourselves that we're connected to purpose and driven to excellence? And so we, in the first few sessions of this Foundations of Leadership, we tested out this idea of would this be just too nerdy and corny, right? And let's face it, there's a lot of people who were just not warming up to it.
Oh, I'm sure. I have no doubt.
Because there's always skeptics. But we came up with our 3 questions, which is, 1 is, who are we? And the answer to that is, we're Valley Health. 2 is, what are we? We're hope and healing. And 3 is, why are we here? And the answer is to serve. So that really incorporates our connection to purpose and our mission. So when I say, who are we? They say Valley Health, right? And when I say, what are we? They say, hope and healing. And you hope that comes off. And then the most powerful one at the end is, why are we here? And when 6,000 people say to serve, in a big room, it makes an impact.
Oh yeah.
And in a small huddle, it makes an impact.
It made an impact in that room.
Yeah, I think
cried.
So. Well, we don't do it every day.
Yeah. I was wondering.
Yeah, we don't do it every day, but I tell you, I do it when many are called together. I think there's strength in it, and so we do it then, and it's just making sure everybody knows that they're a part of something big, and a part of something important that has a lot of meaning.
Yeah.
And I was very proud of them that day. There was a pretty good course of it that day because I was kind of concerned.
Yeah,
it was a risk.
Could have gone differently.
It was a risk.
I'm so glad you took that risk. No, it was great. So I mentioned we were going to talk about transformational leadership, and you talked a little bit about your philosophy, and I know the two have to be tied together, but can you define what transformational leadership looks like to you?
Yeah, I mean, it's trying to, I mean, I'll use the engagement, right? You're trying to transform from relatively unengaged to engaged. I mean, it's when to me, it's like you're in a state and you desire to be in another state. And I don't mean a location, I mean a state of being, and whether that's infections in the OR or whether that's employee engagement, it's trying to say, we're here, we need to be there, and here's why. And then the difference in the middle is the transformation.
Yeah.
And, almost all leadership is transformational in that sense, unless you're just maintaining, and that's more management.
Yeah, I was going to say that's not leadership.
That's more managing, and, it's really, to me, it's can you get people to see where it is you want to go and why it is that they would want to go with you, because it will be better for them and their patients and the company, the ministry. That to me is transformational leadership. Is you begin with the end in mind, and you see if there's buy-in as to why you think that's the right answer. And again, I tried to sell people on. I think if we have a better culture and we're more engaged, that we'll have fewer medical errors, that we'll make more money, that we'll have higher patient experience. You name it. Go through all of those things. We'll have higher employee retention, and mostly my leadership team and the board, they bought into that. And then it was a matter of the real transformation is making it happen, which to me is you got to communicate it, and you can't just say it. You just got to model it, and then when the hard stuff happens, you got to stick to saying, this is what I told you was important. You all were important, not a furlough. So I'm going to stick to what's important, even if that means we make less money or, whatever that may mean. And I think, you've got to do that if you're going to be effective long term, whether you're supervising 10 people or 10,000. They got to know where you want them to go and why it makes sense for them and the organization to go there.
So thinking about the vision overall of Valley Health, what are some other changes that you see yourself making in the coming years? Engagement will continue to soar, I have no doubt, but what else are you working on?
Well, we've made so many changes. The other, one of the things that we were doing prior to me getting there, just kind of, it was pretty new, was a journey to high reliability, which is an idea that we want to be a place where what's supposed to happen happens, and what's not supposed to happen doesn't happen 100% of the time.
Okay.
And so it's trying to move towards zero infections, trying to move towards zero readmissions, zero errors in the operating room, zero falls on the floors, all those safety things. So we also kind of started that transformational journey to we want to be the best. We want to be among the best. If you look at any clinical quality indicator, we want to be the best. And so that was one of the things that we've really invested in.
Yeah.
Over the last 5.5, 6 years. We've gotten experts, hired a lot of doctors, pulled them out of practice, put them in leadership roles, and helped them drive those changes. So I'd say we've had a very nice journey to that high reliability. You'll never get there, but it has become, that's that driven to excellence.
Yeah.
So the connection to purpose is the culture part. The driven to excellence is the high reliability part. And so I'd say those are probably the two biggest, cultural transformational changes that we've tried to embark on. The other thing is just running the business, though. I mean, we've, after that pandemic year, it was, I had a couple of those pandemic years, but, Valley Health in 2019 was about a $900 million organization. I just mentioned to you that we'll finish this year at about $1.6 billion.
Yeah.
So we have grown by, more than half.
That's huge.
And that in and of itself, when you're growing that fast, hiring enough people, getting people to stay, and reducing your turnover so you don't have to retrain, growing that fast, recruiting that many physicians, hiring that many people, opening that many beds, opening that many clinic locations. I've never been a part of anything that's grown that fast. And so that's been a kind of another interesting part of this journey is when you have a business that's growing at that rate, trying to accommodate that growth in some controlled fashion.
Yeah, so as you were talking about that, I was thinking about rankings because I know you're aiming for that 0, right? Aren't you guys pretty highly ranked in several different areas? What are some of those rankings?
We are. I mean, we've got some workforce. We actually have some workplace honors and awards now with Forbes and some other things. Leapfrog, Grade A, U.S. News and World Report. So we're recognized as being high quality. And our stroke program has very high accreditation. Orthopedics program, neurosurgery. It's funny, the test really of how good you are is where does the CEO and the board get their care?
Yeah, that is true.
Because you have to eat your own cooking.
Yeah.
I
never thought about that.
Shortly after I got here, I was a runner for years. I had just my knee was shot, and so I had to get my knee replaced. And it was funny because somebody was, well, where are you going to get it done? Because in the community, people would say, well, I go so and so, and I was like, well, I'm going to Winchester.
Yeah.
I said, as a matter of fact, I'm going to Winchester Orthopedic. Yeah. And I was like, I said, I have complete faith in the level of care that we get here. I've had back surgery here. I mean, if I needed open heart surgery, I'd had, there are some things we don't do, but there's a reason we don't do them.
Yeah.
Because we don't do enough of them or are not good enough at it that we decide, okay, we're not going to do that. But to me, that's the greatest, the greatest example of do you think you have high quality or not is do you get your services there? Yeah.
Did you give them a good rating?
I did. I did. It's funny too. My board chair, he asked me. I had 2 surgeries in like the first 18 months, and he asked me, "Did you just take this job for the insurance, or did you really want this job?" But he was joking. But yeah, I think we deliver outstanding care, and it's nice for it to be recognized by external bodies. We don't apply for awards. We like to get the ones that the data support and that people recognize you. And so we've been fortunate, but that says a lot about our medical staff and our nurses and our clinical people because they create that. You start with qualified nurses and physicians and techs and respiratory therapists. They create quality, and they create those rankings more so than any CEO would. And again, when they're engaged and committed and connected to the purpose, the chances are you're going to get some pretty good ratings out of that.
Yeah. Well, that's amazing. Congrats on all of those. As you guys are growing so quickly, of course, you're having to identify leadership internally, and folks keep moving up in the ranks, right? So how does Valley Health go about identifying emerging leaders within the organization?
Well, we have a lot of it is with that training, right? That we talked about, the call to serve. We do that every year, the foundations of leadership. Because when I'm looking at identifying a leader, the clinical competence or the competence is kind of a given. It's, am I looking at somebody who's connected to purpose?
Yeah.
And can they inspire? And do they care about their people? Do they look at that change jar and really think twice about the decision that they're going to make? So we kind of have done it part of our culture.
Yeah.
We have a very strong performance review system, not as a punitive thing, just as a growth thing. We all set goals. We obviously look at emerging leaders. We look at people's engagement. We look at their financial performance. We look at their patient experience. And so we identify people who are high performers, and then we try to invest in them if they want more. And we do that in the form of paying for higher education. We do that in the form of conferences and training programs. I've a lot of the leadership team has changed since I've gotten there. That's often very, very common with a new CEO. But about half of my leadership team was promoted from within, and about half came from the outside. And of the last new vice presidents or vice presidents have turned over, about a little more than half of them have come from the inside. And I'm super proud of that because that means you're growing talent. And we've also been able to identify and promote a fair number of female vice presidents and senior vice presidents and leaders, and that's not any kind of program or something. It's just that I believe that, I think we're 75 or 80% female employees. It's a lot. It's a lot.
Yeah.
I am by far the minority, and I felt like we didn't have enough female leadership. Because I think, again, telling people there's opportunity and them seeing, that everybody up there looks like me in the C-suite, my words aren't marrying up to my actions. And so we've got some fabulous male and female leaders, but right now I'm bragging on the females that are just doing a great job. And really, many of them have been here 20 years and now they're vice presidents. So they've got the culture, they've got the history, and they are so committed to the ministry. It's palpable.
Beautiful. Is there a formalized mentorship program of any sort?
Not necessarily formalized.
Okay.
We do a lot of coaching. We allow, we ask people if they want coaching. I mentor people on occasion, but we do not have a formal mentorship program, although there are many of us that are doing it. And sometimes, for me, when it kind of happens organically,
it's powerful.
It's a little bit better. And I also believe that a lot of that's your boss's job, right?
Yeah.
Your leaders should be mentoring you, and they should be investing in you. And that's that to me, another mark of a good leader is how are their people doing? Are their people getting promoted? And so that's not something we formally do, but we're just in the process of a transition from a new chief human resource officer. Our previous one retired after 15 great years. Happy to say that her replacement was her second in command. And she's got a lot of ideas about things like mentorship and others. So I'm looking forward to seeing the new ideas she brings to the ministry.
Yeah, that's wonderful. Who are some of the examples that you looked to as you've gone through your own leadership journey? I know you mentioned Brene Brown, so I know you do some reading. What sort of leadership material or leadership folks do you look into?
Well, I really feel like I have been the beneficiary of some incredible leaders myself, and that's where I think most of my leadership. I mentioned the Sisters of Bon Secours. They, I always, when I talk about it, sometimes I get emotional because the change in how I felt about my work was profound. It was profound, and so I look at them, and my wife will tell you that I'm a better husband. My children will tell you I'm a better father. My friends will tell you I'm a better friend, because when you get in your mind that either everybody matters or nobody matters, you really look at things different. So I would say that the greatest influence on how I lead was that that was an inflection point for me.
Okay.
And so I would tell you that's what is the game changer for me. But I also had a great leader, my very first CEO that I worked for, who was this uber charismatic guy that could make you feel exactly what he was feeling. And so I tried to emulate his communication style. And then the next leader I got was not charismatic at all, but was able to criticize me at a rate I could tolerate.
Okay.
And not get mad.
Mm-hmm.
Criticize me at a rate to make me want to improve and understand how other people saw me. And then the last one was the one that taught me that it really matters how my words fall on other people. And so when you put all those together, and you throw in the Sisters of Bon Secours, this is what you get.
It's pretty remarkable.
I don't know if that's good or bad, but
no,
this is kind of what you get.
I think it's good. That's awesome. Thank you for sharing that. All right. I had shared with you we were going to do Leadership Unscripted. So I gave you a listener-submitted challenge there. And so for folks that have not heard this segment before, we take listener-submitted challenges and questions, and we just talk about them. I'm not saying we're an expert on this or you have to follow our advice, but just if we've had any experience in this area, maybe what we were able to do to overcome the challenge. So today's is: I stepped into a leadership role after someone who was deeply respected and well loved. I don't want to just fill their shoes. I want to make my own mark. How do I do that with grace? And this made me think of our conversation earlier about the transition, right? And I'm sure there were many wonderful things going on. But how have you navigated that in the past when you're stepping into a role and you want to make your own mark?
Well, it's always awesome to follow somebody who was not very good, because then it's like low bar.
Yeah, everybody loves you.
I did not do that here. I followed somebody who was really good. I think the thing that I would say there first and foremost is you're going to make an impact because you got the job, and so if you followed somebody good, I think it's a great opportunity to practice something called strategic patience.
Okay.
Not changing something is doing something. And a lot of people come in as leaders and they think, I've got to make my mark. I've got to make my imprimatur on the place. I've got to change what the other person was doing. And I've learned over, transition into 2 or 3 different CEO roles. There's a pace of change that the organization can tolerate, and then there's a pace that it can't. And so, my advice for this person is first and foremost, take your deep breath and really respect the person you took over from, and really, remember whose shoulders you're standing on. And then it'll become evident to you. There'll be those in the organization that say, well, gosh, we've been doing it this way for so long. We need to change that. I mean, when I leave, somebody's going to say, why the heck did he do it that way? But those opportunities, when they make sense, and when you can point to a place you want to go and explain to the people that you're leading why this is a desirable place to go, and get them behind you, you'll know that the main thing is you want to win their respect. You want to respect the past. You don't want to change too fast, but you do want to make them follow you to where it is you think they ought to go.
Yeah.
So I think it's taking your time. George Washington was the person that had the greatest strategic patience. They said he was the best retreater ever as a general, because he knew exactly when to run.
Yeah.
And so sometimes you stand there and you fight, and you lead through change, and sometimes you retreat, pull back from it. But that's my thing. Not too much too fast, and trying to change just because it's not what you do. There's a lot of different ways to do it, and it's everybody do it different, I guess.
So I'm curious about your thoughts on, so you come in, you have your vision for it, but how much time do you spend listening to team members' feedback to see what ideas they have and what they do want to keep that was going well before jumping into specifically your vision where maybe you don't have the full picture. So that's trying to find that balance of, how long do you wait, but also how much feedback do you get so you also have buy-in? What are your thoughts on that?
Yeah, I would not recommend, unless you're coming into a mess, a turnaround, in which case you're not really worried about the person that that they might have been well liked and well respected, but they weren't doing their job.
Yeah.
Right. So if you're coming into a situation like that, you got to move quick because you might be trying to make payroll or you might be trying to save the company in the middle of a crisis. So it's one thing if you've got a crisis. If you're coming into something like I was coming into that was well run, that was financially stable, that had a long history and a well tenured CEO
and a pandemic.
Yeah, and a pandemic. Yeah. Didn't want to create any more crisis, right? I took about 6 months.
Okay.
And I watched how my teammates interacted with each other. I observed how people did their jobs. I observed how they communicated with me. How they treated each other. I asked a lot of questions about, what do you think's working well? What do you think's not working well? And when you'll hear those responses, and then more importantly, you'll observe how they show up. And you'll know, is that person going to make it on this team? And the biggest thing is the people. I needed to figure out who my team was going to be and who I could rely on. And I think that's the most important thing for any leaders. Do you got a group of people you can rely on? So it took me about 6 months, and I didn't make any large strategic moves personnel-wise or just changing an org structure or anything like that. I waited to give myself enough credibility that, okay, he's going to listen and watch, and then he's going to make a change. And I had people on my team that said I took too long, and I had people on my team that said I didn't go fast enough.
Always will, right?
Which made me feel like it was just about right because it wasn't fast enough for some. It was too fast for others. And that's eventually when you're going to have to make some hard decisions. You make personnel decisions, but you can't expect that if you don't make any of those changes that you're going to make any progress.
Yeah.
And if you weren't happy where you were, you wanted to get somewhere else, then it's the people that are going to get you there.
No, all valid. I would piggyback on everything you said. You said it so well. And I would just also share, I think being there consistently and building that trust from the beginning, small habits daily of listening, right? Like you said, spending time listening, getting to know people, getting their feedback over time, I think is important from the beginning, but honoring the legacy of the person before you and knowing that timing is what I was going to share as well.
Yeah. And I think if I had one word to leave with people who are leaders, I think it's authenticity.
Yeah.
It is. I've met so many leaders that could say it all, that had so much talent, but the staff could just say, that's not genuine, that's not authentic. And I think authenticity is what people want to follow.
Yeah.
They don't want to follow what you're putting out that you think they'll like. They want to follow somebody who truly believes that connection to purpose and driven to excellence is the most important thing. My license plate is C2P D2E, and people want to say if he's that nerdy and that weird, he believes it's that hard, at least that's the real him.
Yeah.
And I think that's people want an authentic leader.
That's a good point too, because say that the person prior to them has retired and they were amazing and they think they're trying to fill that person's shoes, and it's this comparison. So then you're trying to become that person and lead the way they were leading instead of being authentically you and leading your way. So I think that's a really good point too. People will pick up on that.
Without a doubt.
Yeah.
Then the front line will pick up on that, see right through it.
Yeah. Yeah. I want to zoom back into our region, our local community. When it comes to healthcare in our region, what do folks need to know about what's going on?
Well, I think we're growing. That's good.
Yeah.
I mean, you can see the campuses see what we're doing on the main campuses, see what's going on at our ambulatory locations in the outskirts of our towns and whatnot. So the main thing I want people to know is Valley Health is healthy. We're a strong organization. We are right now in some serious challenges with House Resolution 1. Okay. The bill that was passed, and I'm not saying it's right or it's wrong, but in the coming years, as the life of this bill, Valley Health will have about a $73 million hole to fill. We will lose payment for care that we will provide to the tune of about $73 million, and that's a big deal because we don't make that much money now, and we're still going to care for those people. So we're going to be making good decisions, but we're going to have to really think about do we do things everywhere? How much new stuff can we do? Because I'm going to take care of our people. Mm-hmm. The first thing I'm going to do. So that's right now that's a big challenge, but we're not in a state of panic because it's happening over a period of years, and who knows what happens in the Capitol over the same period of time. But that's a dark cloud over the healthcare industry right now. It's gonna face some challenges for us. I think we're very resilient. I think we'll manage through it. I don't foresee us shutting down any of our hospitals. I don't foresee us shutting down service lines and not providing care. I just see us having to find ways to do it more efficiently.
Yeah.
And so that's, I think that's probably the biggest thing that I'm managing in the kind of under that bright light right now. Mm-hmm. But the growth that we're experiencing, I think, is going to continue, and that's super exciting. That means a lot of people are coming to our communities. A lot of people are choosing to stay with us instead of go somewhere else. Mm-hmm. And I think that'll continue. We're going to bring about 100 new doctors. Valley Health Medical Group is going to hire probably about 100 new doctors in the next 2 to 3 years, which is going to create more access to people to get in quicker, because I know that it takes a long time to get to see a specialist in our community. That is not different than any other community that's out there right now, but I know when people want to see a specialist, they want to see him in 2 weeks, not 6 months. Mm-hmm. And so, my goal is I'm very, very determined to get access to where you can see a specialist in 14 days or less. Mm-hmm. And so that's the one thing we are working on probably more than any is to make sure people can get access to the docs and providers they need more quickly than they are right now.
Yeah. I think it's really helpful to have you on here and share, the state of Valley Health, and things are good and growing, and also share the things that you're focused on working on, such as that, because as we know, folks get online and have to share all their thoughts and comments, and I get it. I was just sharing earlier before you got here that I try to be the opposite, and every time I go to the diagnostic center, I've had an amazing experience there. Every time that I've done anything with Valley Health, or my family has, I always try to go leave a positive review and give positive feedback to balance it out. But how do you navigate that when in the community you can hear so many negative things, but it doesn't make it true, and it doesn't really define the culture there?
Yeah, and I think that there's no question. You got to have a pretty thick skin, and I would never try to make somebody invalidate the way they felt about their experience with us, and I would say we get it right most of the time. Mm-hmm. And I would tell you we're on a journey to high reliability where we get it right all the time. But that's a state that really doesn't exist. Mm-hmm. But we listen to folks who are feel like they've had a bad experience. We try to explain. We try to do service recovery. And again, I get a lot more people telling me how great things were than the ones that don't.
Yeah.
But I don't ignore the ones that have had a bad experience. Mm-hmm. I always try to find a way to put them in the right hands. And sometimes that means we're not the right place for them. it's it really is, kind of, I won't say it's tough love, but if somebody is just never going to be satisfied with it, then by all means stop trying.
Yeah.
And so we're happy to help people find care other places if that's how they're experiencing us. But I mean, we're pretty much in the top quartile of patient experience. That feels pretty good to me. In today's world,
yeah,
when everybody's angry at everybody,
yeah, that's worth celebrating.
yeah. So we feel pretty good about that. But we know we have room to improve, and we'll always have room to improve. But we're going to always keep trying. And I will tell you that most people are very glad when they have that moment that they need us, when they've had that cardiac event or that stroke or that accident. They are really, really happy that Winchester Medical Center is on that corner, because I can tell you this from 35 years of experience. Winchester Medical Center is a unicorn compared to what most cities our size and most regions our size have. It is, I mean, it's a 500-bed tertiary medical center with just about every service line known to man, and they're done well.
Yeah.
And most people would have to drive 50 miles or would have to be flown. And instead, we've got that right here in little old Winchester. And there's not a person that visits our campus that comes into my office and says, "My gosh, this place is beautiful. I had no idea." And I'll leave you with this. It's funny. One of my colleagues recruits the doctors here. And Winchester's not that easy to recruit, right?
Yeah.
It's in the country, right? So we recruit people, and when we recruit a doctor, the first part of it is Zoom call. And you're trying to explain where Winchester is, and you're trying to figure out if this is a good doctor and if it's a good fit. And what we found, at least when Valley Health is hiring the physician, what we found that about 50% of the people who have a Zoom call with us come to see us. So about 50% can get past the fact that Winchester's where.
Yeah.
But of the 50% who come and visit us, of the ones we offer a job, 85% of them take it. And I would tell you that is primarily because when they walk in to Winchester Medical Center or Warren or Hampshire, what they see is really nice facilities that have been well maintained. They see really smart people who are highly competent, that care, and that are highly engaged, and they realize this is a pretty good place. I want to do my thing here.
Yeah.
And so that's kind of cool.
Yeah, it is cool. It's something to be proud of for sure. Awesome. Thank you. All right. Well, I want to let you go ahead and close it out with a branching out challenge. So based on what our listeners heard today, what do you want to challenge them to do, to think about?
In terms of their leadership styles?
Yeah.
Yeah, I'm going to go back to that piece of being authentic.
Okay.
I really do think that there's not enough of that in leadership. Trust is at an all-time low. And people are looking at all of our institutions, whether that's government, whether it's a church, whether it's a large organization like Valley Health, and people are naturally thinking that something's not right, that institution is too big, it's out to get me, that you can't believe what they say. And right now, I think for leaders to be effective, you've got to be authentic. You've got to be consistent between what you're saying and what you're doing, and people got to know that you actually care.
Yeah.
And that you're not disingenuous. And I think that you can be average competence and intelligence. I feel like I am, but if you can be 100% authentic, people follow that.
Yeah.
And so I would say, to me, it's harder for younger leaders to do this. because as you get old, you just get miles on you, and you just realize what you see is what you get. But as you're younger, take a chance, take a risk, be your authentic self, because it's who you are.
Yeah.
And it's a lot less work to be who you are than who you want to be.
And I think that takes some time and reflection too. It makes me think of like your foundations training, right? Actually taking time to figure out your purpose. Well, what impact are you trying to have as a leader? What leadership style do you want to use? Because I feel like over time, yours transformed as well.
Without a doubt. Without a doubt. I think that, and the last thing is be very, very aware of how your words fall on other people. Because I think we think we're saying something, whether it's our spouse or our coworkers or our board members or our physicians, we think we're saying something one way, and very often it is not. The words aren't falling on them in the way you intend.
Yeah.
And so I think being very mindful of that, and how you choose your words, and how you go into things, because I don't know, people are so hateful to one another these days. I don't understand why you'd want to be that way.
Yeah, I don't. And it's exactly why I do this, because I feel like we all have the opportunity to have a positive impact on people. So why wouldn't we, right? Every single interaction. So I agree 100%. Thank you so much for being here. I appreciate your time. You shared so many valuable insights today, and you are such a blessing to our community, Mr. Nantz. So thank you so much.
Well, please call me Mark, and thank you, Sierra. It was great being on.
Of course. And thank you for sticking through to the end of the episode. I hope you found value in hearing a little bit more about transformational leadership and Mark's philosophy. And I hope that this Winchester community and the region around has a better understanding of Valley Health and the services that they're providing in the region. As always, be sure to follow or subscribe so you're getting those notifications every Friday at noon Eastern Standard Time when a new episode drops. If you'd like to be a guest, or if you'd like to submit a leadership challenge that you're facing, be sure to reach out at info@branchingoutpodcast.com. Until next time, keep branching out.